आपको भी को होस्ट बना दिया है। डॉक्टर अरुण सर,
हाँ
आपको भी
ठीक
को
है, अभी
होस्ट बना
अभी
दिया।
सिरखाने जी को भी बना दे रहे हैं हम लोग ना।
ठीक, ठीक है।
हाँ सर, कहिए सिरखाने जी ज्वाइन करें अपने आईडी से, तो उनको को होस्ट बना लेते हैं।
मैं बात कर सर।
हाँ जी सर।
अरुण सर,
जी जी जी।
सर को होस्ट बना दीजिए ना। सर के नाम से सर एंट्री कर लिए है ना, हम वहीं पे है सर, सर के ही घर पे है।
नहीं, क्या करें सर, क्या बनाना है?
उनको को होस्ट बना दीजिए। स्मिता सर को बता दो ना अरुण सर को कि इनको को होस्ट बना दे, जैसे स्मिता को अपने को होस्ट बनाया ना सर।
हाँ,
हाँ
ओके सर, सर बना दिया, रुकिए बना रहे हैं।
हाँ
अच्छा, उनको
हो
शुक्ला सर
गया।
को भी को होस्ट बनाना पड़ेगा ना?
हाँ हाँ, तो
सर
पीपीटी
बना दिया है।
शेयर हो जाएगी ना तब। हाँ
सर
बना
बना
दिया
दिया
सर।
है।
हाँ बना दिया है, बना दिया है।
ठीक, थैंक यू सर। और ये उस पे यूट्यूब पे भी डायरेक्ट टेलीकास्ट होने लगेगा सर?
उसका सर उसके लिंक अलग है सर ना, अभी तो हम लोग जूम पे ही करके इसको रिकॉर्ड कर लेते हैं इस मीटिंग को।
अच्छा, नहीं जैसे हम लोग यूट्यूब लिंक भी पार्टिसिपेंट्स को दिए हुए हैं।
हाँ वो सर ना, वो एक्चुअली जिसने ये यूट्यूब की लिंक क्रिएट की है ना सर, उनसे एक बार बात करनी पड़ेगी सर
अच्छा,
कि
ये
वो
आपने
कैसे
नहीं
करना
किया था
है।
सर ना?
ना 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 सर, यहाँ से नहीं, वो जो होस्ट जो है ना सर, वही कर पाएंगे।
हाँ हाँ।
तुम स्मिता प्रिपेयर्ड हो ना? यूट्यूब पे
ये
भी शायद
सर।
था तो है सर।
यूट्यूब
हाँ
पे शायद जाए।
हाँ है सर, उसकी भी लिंक दिखा रहा है
मुझे पूछिए
और
सर।
यूट्यूब
अभी
पे टेलीग्राम का लिंक चाहिए
जा
तो
रही
सर उसमें है मैसेज में।
सर, आपके ग्रुप में जो है ना, उसके वाला, उसमें सब लोगों को सर ज्वाइन करने के लिए बोल दीजिए सर।
ठीक।
टोटल कितने लोग हो गए? 100 से ऊपर होंगे तो यूट्यूब पर लेना पड़ेगा।
नहीं, 125 लोग हो गए हैं तो 100 तक आएंगे, 25 लोग अपना यूट्यूब पे जाएंगे।
अच्छा ठीक है, ठीक है।
अच्छा, ये यहाँ से यूट्यूब पे भी जा सकते हैं, यहाँ से होस्ट करना है, जब होगा तब हम कर लेंगे इसको। इसके बाद तो बताइए स्क्रीन शेयर मुझे पीपीटी ओपन करके रखना है।
हाँ, इस पे लिख के आ गया सर, दिस मीटिंग इज बीइंग लाइव
रिकॉर्डेड,
स्ट्रीम।
रिकॉर्डेड होगी सर।
लाइव स्ट्रीम्ड भी आ रहा है।
लाइव स्ट्रीम उस पे आपने किया ना सर।
हम्म।
आप सर, आपको पीपीटी दिख रही है क्या सर की?
शुक्ला सर की, हाँ।
हाँ
जी जी।
अब फुल
पीपीटी
स्क्रीन दिख रहा है ना सर?
नहीं, अभी तो हमको स्लाइड फॉर्म में दिख रहा है।
फुल स्क्रीन दिख
नमस्कार
रहा होगा
सर।
सर, एक बार चेक कर लीजिए।
सर हम लोग रेडी हैं और प्रोफेसर शुक्ला सर के ही हम हैं
हेलो
सिस्टम पे, वो भी रेडी हैं।
अरुण
हाँ
सर।
हाँ, नहीं हमको
तो
फुल स्क्रीन नहीं
अब
दिख रहा
आप
है, एक एक स्लाइड दिख रही है।
बता दीजिएगा। 107 बजे शुरू हो जाएगी, ठीक है सर, ठीक ठीक। और 125
अब
मेंबर्स अभी
सर
रजिस्टर्ड हुए
मैं
हैं।
देख लेता हूँ सर, खुद ही देख लेता हूँ।
जी।
ठीक है, आप एक बार देखो, एक बार री स्क्रीन शेयर
आप
करेंगे शायद हो
यूट्यूब
जाए।
पर चले
हाँ
जाएंगे,
हाँ
100
हाँ,
से
मैं वही
मेरा
करके
सारा
देखूंगा।
तो हम लोग 7 बजे ज्वाइन करते हैं उसको, ठीक है सर? ओके।
नहीं सर, आप लोग ज्वाइन कर लीजिए अभी सर, क्योंकि पार्टिसिपेंट ज्यादा है ना, 100 को फिर ज्वाइनिंग में दिक्कत आएगी।
7 बजे
कोई
7 बजे से चालू ही हो।
तो
अरे
फिर आपको स्पेस नहीं मिलेगी, फिर आप ज्वाइन करके
करके वीडियो आप करिए।
अच्छा, ये देख रहे हैं फुल स्क्रीन दिख रहा है।
एक बार हम ग्रुप में मैसेज भी कर दे रहे हैं। वही फुल स्क्रीन नहीं आ रहा है सर का।
मैं देख रहा हूँ।
आपका स्लाइड दिख रहा है
दिख रहा है सर?
फुल स्लाइड दिख रही है फुल स्लाइड
दिख रहा है फुल स्लाइड?
हाँ ये और साइज बढ़ जाएगा
हाँ तो वही नहीं है दिख रहा वही
फुल स्क्रीन सर हो रहा है, लेकिन एक्चुअली नेक्स्ट स्लाइड पे जब मूव हो जाएगा तो वो दिक्कत हो रही है। हम उसी को थोड़ा सा साइड
ठीक है
पढ़ने में तो आ रहा है।
और बहुत हो जाएगा
स्मिता भी आ गई है
वो ज्वाइन कर लिया।
हम लोग यूट्यूब पे लाइव हैं सर।
लेकिन ये हम ऐसा करेंगे दिखाई पड़ेगा, देखिए वैसे ही करना पीपीटी में
हेलो मेरे पास नहीं है उसके अंदर
तो इसी इस पर कर लेते हैं।
मेरा नहीं है
बट वो विदिन भेजा था पूरा हॉस्पिटल का कुछ नहीं आया, वेंटिलेटर सपोर्ट भेजा। हाँ बस हो रहा है ना वो, क्योंकि होस्ट में है ना वो।
A very good evening to one and all. I am Dr. Smita Pandey, Junior Resident at Department of Shalyatantra, Banaras Hindu University. Today I am going to be your host for today's webinar. I am delighted to welcome our esteemed chief guest speaker, sir, delegates, and all the participants in today's webinar. It is with great pleasure and honor that I welcome Dr. Ashutosh Kulkarni, sir, President, NIMA Central Council, Dr. Raman Singh, sir, President, NIMA Surgical Society Central Council, and last but not the least, our most esteemed guest speaker, sir, Professor V.K. Shukla, sir, to our Shalya webinar, Making of a Surgeon, organized by NIMA Surgical Society, UP. Before starting the webinar, I would like to play Dhanvantri Vandana, the chant dedicated to Lord Dhanvantri to invoke positive energy and blessings from the God.
नमामि धन्वन्तरिपादे देवम् सुरास्ते वन्दितपादपद्मम् Ridhoshadina Chavyo Panchatmakadehakajam Santapasampat Namami Dhanvantarimadite Laveen Nilam Mudikante Kantam Shantam Paredvadashamakhyamurtam Murtim Shatano Subano Namami Dhanvantarimadite Namami Dhanvantarimaditevam Namami Dhanvantarimaditevam.
So, before starting the webinar, I would like to give some information about NIMA. The National Integrated Medical Association NIMA is an Indian non-governmental organization established in 1948. It is the largest organization representing institutionally qualified ISM graduates who have undergone a conjoint study of Ayurveda and Unani and allopathic system of medicine from institutions recognized by CCIM. So, to achieve honor, dignity, and to uphold the interest of the integrated medical practitioners and to promote the integral medical education and practices, NIMA has been working tirelessly to protect the rights of the ISM graduates since its inception. This is a special opportunity for us to gain insight from the experienced surgeon on what it takes to become a successful surgeon. Throughout this webinar, we will explore the challenges, triumphs, and dedication required to pursue a career in surgery. We will hear from our esteemed guest speaker who will share his personal journey, experience, and advice for these aspiring surgeons. Now it is the time for the informative session for which we are gathered here today. So please join me in giving a warm welcome to our esteemed guest speaker, sir, Professor V.K. Shukla, sir, who is a renowned surgeon with a wealth of experience and expertise in the field. We all know about him, but as a formality, I am going to briefly introduce about his achievements. He has been recognized for his outstanding contribution to the field of surgery with numerous prestigious awards and honors. Sir has been the former rector of BHU, former officiating vice chancellor of BHU, former director IMS BHU, former medical superintendent at Sir Sundarlal Hospital BHU, and former head of department general surgery IMS BHU. Sir did his MBBS in 1975 MS Surgery in 1980, and MCH from Wales in 1989. Sir has about 41 years of teaching experience at UG level and 39 years in PG level. The research experience of Sir is 41 years and clinical experience of 39 years. Sir has been a member of many important institutes like Institute Body of All India Institute of Medical Sciences, New Delhi, appointed by Ministry of Health and Family Welfare, New Delhi in 2022, and many others. Respected Sir has been awarded with various recognitions and achievements like Lifetime Achievement Award in 6th World Congress of World Union of Wound Healing Societies at Abu Dhabi, UAE 2022. Lifetime Achievement Award in Global Wound Conference 2018 at Kuala Lumpur from September 21-23 in 2018. Sir has been visiting professor at various institutes all over the world like Keck School of Medicine, University of Southern California, Los Angeles, Brown Medical Institute at Rhode Island, Morehouse School of Medicine, Atlanta, and many other. He has total 506 national and international publications, total read 61,018 and total citation 8,041. He has many publications like book on carcinoma of gallbladder, book on measurement in wound healing, science and its management from Springer. So we are very much privileged to have such a distinguished speaker to share his knowledge and expertise with us today. Before beginning, I request all the participants to ask their queries at the end of the lecture in the chat box and actively participate and engage with our speaker. We are truly honored to have you, sir, with us today to share insights and wisdom on the art of science of surgery. Without further ado, let's extend a heartfelt welcome to Professor V.K. Shukla, sir, and express our gratitude for his presence in this webinar. Thank you so much, sir, for giving your precious time, and now you can start, sir.
Thank you, Smita. Am I audible?
Yes, sir. Yes, sir, you are audible.
Okay, so good evening to all of you. At the outset, I'd like to convey my gratitude to the President NIMA Central Committee, Dr. Asutosh Kulkarni, President NIMA Surgical Society, Dr. Raman Singh, President NIMA Surgical Society UP, Dr. Anand Vidyarthi, Secretary Dr. Manoj Yadav, Treasurer Dr. Anil Tripathi, members of the NIMA, delegates, dear students, ladies and gentlemen. At the outset, I'd like to thank Dr. Raman Singh and his team for giving me this opportunity to share my views with you. He asked me to talk about the making of a surgeon. So the first thing which comes to my mind is about the word surgeon itself. What is the history of the word surgeon? In English, the surgery, and in French, it is chirurgie. And both the words are derived from Greek word chirurgion, which means handiwork. From kher means hand and ergon means work. And if you look at the Chinese word history, the Chinese word is Shaoshu, meaning the skill or art of the hand. So that is how the surgeon is described. Next. If you look into the history of the surgery, it is interesting to note that our Indian history is not mentioned when Westerns talk about the history of surgery. But if you look at the Treta Yuga of Lord Rama and the Dwapar of Lord Krishna, if you remember the war between Lanka and the Mahabharata, there are descriptions of treating the wound. You all might remember, the Vaidya Susheshna, who was Hanuman brought him from Lanka to treat Lakshmana. So it is more than 9,582 years before Common Era. Egyptians practiced surgery as early in 1600 BC, and their papyrus vividly describes the splinting of fractures, the care of wounds, the drainage of abscesses. So practiced surgery in 600 BC in Varanasi itself, and is known as the father of surgery. Hippocrates practiced in 400 BC and commonly described as the father of medicine. During the Middle Age, surgery was mainly performed by barbers as part of their duties. Now, come the barbers got involved? Earlier, the healthcare professionals used to be monks, and monks were forbidden to spill blood. So, to help them out, barbers were asked to perform these surgical procedures, and that is how they came to know as the barber surgeon. In 1754, when the Royal College of Surgeons was established, these surgeons were asked to merge with the Royal College. Those who merged, they carried the legacy of barber surgeon, as they did not change the title of doctor, and they prefer to continue to use the Mr. as compared to the doctor. Then John Hunter, Scottish surgeon in 1728 to 1793, he applied the experimental methods in surgery. Now, why one should consider to become a surgeon in Bharat? Bharat is the most populous nation in the world. Its healthcare industry has only grown since its independence. With the growing population and requirements for the healthcare facilities, the demand for doctors is increasing. While we all aim to achieve specific goals in our lives, we enjoy the journey more than we appreciate the realization of our goals. The field of medicine is fascinating. The satisfaction of saving lives goes far beyond the feeling of anything. A doctor is an honor and a responsibility of a lifetime. If one wants to become a doctor, he or she will need self motivation and an unshakable reason for pursuing a career in medicine that should come from within. How one can become the surgeon? Passing the 12th grade in physics, chemistry, and biology with necessary cutoffs. I think that is about 50%. Clearing the NEET UG examination. The students have to appear in the examination and compete for 108,940 seats available, for which about 2.5 million candidates compete. Attempting then, after competing and crossing that percentile, they attend the counseling procedure, and which paves the way for their admission to MBBS course. Students must complete a 12-month required rotation internship during the MBBS. After successful completion of MBBS degree, one becomes eligible for a highest degree in medical sciences, that is clearing NEET PG, the NEET PG which is administered by the National Board of Examination. For admission to AIMS and JIPMER and other institute of national importance, the common entrance test is conducted. PG medical seats available is about 70,645, and DNB seats are available is about 14,755, for which about 2 million students compete. Selection and admissions to medical colleges depend on the cutoff score and merit list. The next step is to earn a PG degree with MS/DNB, being one of the most popular PG courses following MBBS or the BAMS. The path to becoming a surgeon begins with this degree. A successful career as a surgeon will be paved by a residency program with a competent mentor in addition to the qualification and skills for becoming a surgeon. What are the options for a qualified surgeon? Once one qualifies, the options are either he can go for the clinical practice, he can set his own clinical practice, he can try for a government job because there are a lot of vacancies in the public sector. He can also, as you know, the Bharat has become the medical hub not only for domestic patients but also for the international medical tourism is well known and well established. So several global hospital chains are highly in need of skilled and qualified professionals. The next option can be the super specialization. Aspirants with a master degree have an opportunity to continue their education and pursue a super specialty degree. Super specialization course generally takes about another 3 years. Super specialty degree holders are preferred largely by the super specialty hospitals. Now, once you become the surgeon, there are certain responsibilities which also come with your degree of surgery. Analyzing and evaluating a patient's medical situation and medical history, as what we call history taking. And as we always tell, that history taking gives you the 50% of your diagnosis. Engaging in conversation with the patient and addressing any worries they may have regarding their general health and well-being. prescribing the necessary tests and examination to identify the underlying causes of the patient's condition, examining and evaluating the test results to diagnose and determine any conclusion. One must possess good night. One must possess other attributes as well. Without them, a career in surgery may prove challenging and unrewarding. The other attributes are the surgeons must be able to manage crisis and emergency situations, and they must have the stamina for the long and grueling hours of surgery. They must have extended periods of absolute concentration without break, because sometimes surgeries may continue for 6 to 8 hours, working with mind and hands so that they don't develop the mental and the physical fatigue. Physical dexterity, if one had difficulty with dexterity throughout life, surgery may prove difficult for him or her. Now, respect for the human body and human life is paramount. Primary motivation must be love of and respect of the human body and human life. This is what I used to tell my residents, that if you treat a patient or see a patient, you must think that if he is your relation, how will you treat him, and that is how you should treat all the patients. A thorough knowledge of anatomy is the foundation of surgery. Now, what are the attributes of the 20th century surgeons? And in 20th century, the great surgeon will be supremely confident. He will be flamboyant, dogmatic, and rich, while the importance of the surgical procedure could be judged by the size of the scar and the type of a scar. People used to tell that the scar is the signature of the surgeon. That is how a signature, a surgeon's repute is established. And the saying was, the big surgeons make big incisions. A great surgeon would also be bold, inventive, as well as wise. A good surgeon knows how to operate. A better surgeon knows when to operate, and the best surgeon knows when not to operate. You must remember this. What are the basic principles applied in surgery? Every surgeon applies fundamental principles in the operating room. Human tissue reacts to the injuries in predictable way, and set of guidelines have been evolved to promote optimal healing. So proper treatment planning is important. It is said that good surgeons always operate twice. They visualize and plan the operation mentally before doing the actual surgery. Then minimum invasive surgery. When possible, consider alternatives to open surgery. Scope assisted surgery versus an open surgical procedure, intervention, radiology, or angiography. As you remember, that angiography and the embolization has changed the outcome in patients with trauma. Good visualization conditions, surgeons must be able to clearly see the area they are working on. Exposure of the surgical site, the retraction to offer the surgeon maximum exposure, and surgeons always seem to complain about the light. Suctioning and sponging, this is necessary to remove excess blood which may obscure the operative field. And it is mandatory that you must handle the tissue gently and with care so that little injury is caused. Proper control of bleeding within the limits of minimal use of cautery, minimal suturing, minimum sponging, and every action must be purposeful. And one should not waste time in the OT. And in 21st century, every time the time is cost effective. If you take less time, if you take more time, it is going to cost to the patient, because these corporate hospitals charges the OT charges as per the time used. Then anatomical consideration, a surgeon needs to have detailed knowledge of the structure of the human body, which is very important. A surgeon must have a comprehensive understanding of how the human body functions. It is critical for surgeon and members of the surgical team to take into account the fears and preconceived ideas of the patient about surgery and its outcome. Certain diseases are more prevalent in specific socioeconomic groups than in others. Like in high socioeconomic group, the diabetes, hypertension, and cardiac diseases are more common. Religious, there are the transfusion of blood or transplantation and donation of organ is a taboo in some religious groups like Jehovah's tribe. They don't give consent for the blood transfusion, so you can't transfuse blood and can't do the organ transplant. There are certain religions where they don't donate the organ, as they say it is taboo in their religion, but they do receive the organ. Financial, what are the economic implications of the proposed operation to the patient and healthcare organization? And what are the expectations of the patient from this procedure and its success? Communication, it is the key to the success of any surgeon. You must communicate with your patient and the patient party. It is essential the patient understands the parameters, risks, and limitations of surgery and anesthesia. Because the moment we advise patient surgery, the first question they ask is, sir, is it safe? So one must convince the patient about the safety of the procedure, providing information on scars and other conditions that may be present after surgery is necessary. It is again very important, and this reminds me of my stay during my MCH in Wales in late 80s. I saw a patient in the clinic with the varicose vein. She wanted to get it operated, so I asked secretary to post her for surgery. After the patient left the outpatient, the secretary told me that, Doc, don't touch this patient. I said, why? She said, this patient had taken Mr. Tudor Davis, who operated the other limb, to court for the stain in the scar. And the Mr. Davis did not inform her that he is marking the site for with methylene blue. This might give a scar to the color to pigmentation to the scar, and that is why she took him to the court. So I told her next visit that, well, Miss Davis, I can't operate you because I have come from India and I have to go back. So I don't want to get involved in the litigation. She said, no, doc, he didn't inform me. You go ahead and do the surgery. So finally, I had to do operate, and she went happily. So what I'm trying to communicate here is, though it appears is very small thing, but it can take you to the court. So try to ensure that we have given full information to the patient. The patient is as prepared as possible for the operation and what may transpire when it is finished. Informing the patient is also very important. This includes data about the proposed procedure and the alternatives. Say, for example, when I was a student in 70s and 80s, the open cholecystectomy was the gold standard for the gallstone. Now it is the laparoscopic cholecystectomy which is the gold standard. But then you have to convince patients, which one is better. If you give them the option that these are the two options, they said, whatever you think is good for me, you do it. But you must explain the patient what are the advantages and disadvantages, and then what is the complication rate between the two procedures. And try to ensure and make sure that patient knows about the procedure, what you are going to perform and its outcome. The patient must also be informed about any potential pain or discomfort that may be experienced, as well given pre and post operative instruction. What are the implications of the surgery? Will the patient be able to continue with the normal activities like studies, work, sport, hobbies? If not, will the condition be temporary or permanent? Or does the patient need a medical certificate in case of any disability? Complications, what can go wrong during and after the operation? This must be informed to the patient and they are mentally prepared for it. Prognosis, what is the success rate of the surgical procedure and for how long will the benefits of this operation will last? So these things have to be informed to the patient. What are the various disciplines which are available in surgery? General surgery is performed by surgeons trained to manage surgical procedures covering almost any organ system. And this again takes me back to 70s. When I was a student, surgery was the main department, which included the surgery, IENT, radiology, anesthesia, radiotherapy, everything coming in the general surgery. But with the passage of times, they all separated out as the broad specialty, and then the general surgery is again separated out as super specialty, like in the form of pediatric surgery, plastic surgery, urological surgery, and the cardiothoracic surgery, surgical oncology, and the trauma surgery. Then other specialties are the ear, nose, throat, oral surgery, neurosurgery, obstetric and gynecology, ophthalmology, orthopedics, and so on. What are the types of surgery? Open surgery is when a surgeon makes an incision. Aspiration is a type of biopsy procedure where fluid and diseased tissue are removed for laboratory examination. Cryosurgery is a minimally invasive treatment where diseased tissue is destroyed by freezing it using minus 20 to minus 50 degrees centigrade temperatures. And the indications are the skin tumors, skin tags, and freckle can be removed by this method of surgery. Electrocarditis surgery uses electric instrument operating on high frequency electric currents, and this current can be as high as 100 kilohertz to the 5 megahertz. Electric currents can harden tissue or destroy it, so one must have the biopsy before you use this procedure, otherwise, you will lose the tissue. In essence, a surgeon burns away diseased tissue or growth or makes surgical incisions while the electric current seals up blood vessels at the same time, thus minimizing the blood loss. Laser surgery utilizes laser beam to make bloodless cuts in tissue or to remove surface lesion using 200 watt to 600 watt energy. Lasers can be used for eye surgery, removal of skin marks and small tumors. Plastic surgeons and the dermatologists are using a lot. Scope surgery is minimally invasive since it does not involve slitting open of the body as a surgeon does it in open surgery. Common scope surgeries can be laparoscopic surgery, endoscopic surgery, and colonoscopic surgery. Shock waves is a non-invasive surgical technique where sound waves are used to break apart kidney stones. The sound or shock waves using 1500 to 2500 shock waves come from outside the body, and currently it is considered the surgery of choice to break apart large kidney stones. Ultrasonic scalpel use sound waves to make surgical incisions that minimize the blood loss. Extreme precision is needed to remove small and delicate tissues, but can also be used for large tissues using 23 to 55 kilohertz ultrasonic energy. Now, coming to the frontiers of surgery, the main is the robotic surgery. It has really revolutionized the field of minimal access surgery. A surgeon can operate by sitting at a computer console. The console provides the surgeon with a magnified 3D view of the surgical site from which he or she can control the movement of the mechanical arms. The advantages of this technology include fewer complications, quicker recovery, and smaller, perhaps less visible scars. It is possible that surgery can be performed on a patient who is a long distance away, including operations on astronauts in space or soldiers in the battlefield or a uh, person traveling in the ship. The other frontier is the tissue in engineering or regenerative medicine. According to the National Institute of Biomedical Imaging and Bioengineering, the goal of tissue engineering is to develop biological substitutes that restore, maintain, or improve tissue functions. As you can see now, the prosthetic valves are being used. Next. What are the post-surgical discomforts and complications? First thing is patient is under anesthesia, so reaction to the anesthesia can be first thing. Although it is rare, patients can experience mild to severe allergic reactions to anesthetics, and hence one has to be careful. Nausea and vomiting from general anesthesia is quite common side effect. Restless and sleeplessness. Then, since we put the endotracheal tube, there can be soreness in the throat, and in summers, as we see, the thirst is another complaint by the patients. Shock is created by excessive blood loss, wound infection, brain injury, or metabolic problems. Urinary retention, elderly patient may undergo urinary retention. Soreness, pain, and swelling in the scar region. Then other common complication is the lung complication. This complication is monitored for the first 48 hours after surgery. So if you are asked a question that what could be the common cause of fever in first 48 hours, this common cause will be the chest infection. Sometimes deep breathing and coughing exercises are mandated for the patient to minimize the risk. The most common symptoms include wheezing, chest pain, fever, and cough. Other complications can be wound infection, delayed healing, non-healing, sinuses and fistulas, rejection if the patient has undergone transplant, and there can be organ rejection of the organ transplant. And the best example is rejection of the kidney transplant. Though there can be excessive healing, so it is more commonly seen in Negroes, keloid, scarring. So you must inform the patient that If you are giving incision in the midline, in the sternum area, these scars have tendency to go hypertrophy or keloid, so the patient should be informed about this. Pigmentation and loss of normal pigmentation should also be communicated to the patient. Loss of function. Sometimes a patient will be unable to perform one or more tasks or activities after the operation that were possible before the surgery. For example, common example is the after total thyroidectomy, if you damage the recurrent laryngeal nerve, the patient may lose the voice. So they should be informed what are the chances of having developing this complication. Now you may ask, what are the avenues for the surgeons who qualify? The avenues are the corporates in India like Fortis, JP Hospital, Apollo Hospital, Ramakrishna Multi Specialty Hospital, Narayana Healthcare, Max, and so many. The What are the other possibilities for a surgeon? The more accomplishment you have under your belt, the better it is for your settlement. The use of technology to do operations with the aid of robots and other instruments will increase your worth and make you an asset to your organization. Specialization is undoubtedly a key element that will elevate your status in society. Nevertheless, be careful while selecting a specialty because each one requires time and money. Moving to a semi urban location is another excellent strategy to boost your possibilities. Now, coming to the developments in general surgery, gender imbalance has long been an issue in surgical specialties. The recent figures showing that only 12% of the registered general surgeons are females out of 31,200 general surgeons who are registered on record. The females are 2,279, which is around about 1 is to 10 ratio. But 30% of surgeons currently in training are females. So there is hope that this balance will be restored in future. General surgery is a leading specialty in keyhole surgery. What is future of surgery? Both technology and surgical techniques have seen a significant change recently. As I told you that when I was a student, lap open cholecystectomy was the gold standard, and now it is the keyhole surgery. When I was a student, open prostatectomy was the TURP was the treatment, but now it is the medical treatment. So it is the change with the passage of time, which as a surgeon you must accept the change and move with the time. The technique and tools are being improved, which greatly lowers the risk of the patient. The use of robotic surgery and minimal invasive technique is one direction we anticipate the future of surgery to take. Tissue engineering and regenerative medicine are two other developing areas of the surgery. The medical professionals here use biomaterials to aid the patient's recovery. An illustration would be the use of stem cells or scaffolds to assist a patient with an illness. Like in keratoplasty and in wound healing, it is used in a big way, the stem cell. But the main hope from this tissue engineering is the ability of the person to develop organ from patient cells, and if it comes into existence, it may replace organ transplant by giving these cells. So, to conclude, Mr. Chairman, ladies and gentlemen, the demand of the job can be physically and psychologically taxing. A surgeon's position calls for in depth medical expertise as well as precision, devotion, and skill. A career as a surgeon is rewarding since it improves people's quality of life. It is not an easy job to save a life. It requires lots and lots of hard work, sleepless nights, and years of practice. Before I finish, I'd like to appeal to all of you that you must participate and celebrate the Festival of Democracy by raising your voice and casting your vote. Thank you. Good night. So, if there is any question.
Thank you so much, sir, for this wonderful and informative session. Is there any questions you can ask now? Anybody have some question?
I think the all by the assimilated that has gone away.
So the one question is there in the chat box. What are the scope and opportunity for Ayurvedic surgeon in the field?
Good question. I think, see, the opportunities for advanced surgeon is that you must go with time, as I said. Now, the Ayurveda gave, the char sooth treatment, which is being practiced by modern medicine and surgeons also. You'll all agree with me. Similarly, you have to accept the challenge and discover on these lines, on the herbal basis, herbal medicines and all, to its use in cancer treatment, in wound healing treatment, and similarly, these developments, technical developments must follow, and the tissue engineering development must follow. Until unless you follow and try to implicate these developments into your Ayurveda practice, you lag behind. So you must try to involve and use these techniques in your Ayurvedic practice to come at par with the surgeons of the modern medicine.
Thank you, sir. Any other question from the participants?
Hello.
Yes, please ask.
Hello.
Yes,
Sir.
yes.
Hello. Sir, good evening, sir.
Good evening.
Sir, is there any provision to Ayurvedic surgeon conduct or perform laparoscopic surgery, appendectomy or GB or hernia?
Not at the moment, but I think if you look at the new education policy 2020, this is encouraging, that there has to be crossover, and there are these courses which they are proposing, that the Ayurvedic graduate can come to the main modern medicine graduate can go to the Ayurvedic medicine. So if this integration takes place, I'm sure that the day is not far off that when you'll be permitted to do what the modern medicine surgeons are doing.
Thank you, sir.
So there
Which
is
one?
another question
Yeah.
from Vaidya Amar Dwivedi, that only 5 to 6 states give legal permission to practice and use the integrated medicine. So
Yes.
how they will the Ayurvedic surgeon will excel in their field?
I think here it is the responsibility of the NIMA, and I'll request Dr. Astos Kulkarni and Dr. Raman Singh to take this up with the government, because when it comes to give the ratio of doctor per population, then the government is using all pathies. But when it comes to the permission of practicing, they are discriminating. This is a not on. I think the NIMA has to take this issue with the Ministry of Health and Ayush, and they all sit together and try to resolve this issue. It can be done. Only thing, there has to be a drive for it.
Yes, sir. So there is another question from Harjeet Rangari, that
Yeah.
what about the super speciality after MA Shalyatantra?
Yeah, this is one issue. That is why I was debating, should I include it in the talk or not? Because in Ayurveda you don't have super specialty, but now people are trying to start this. Say, for example, I will suggest that, say, Char Sutra is a well established, and you should come out with some new developments in this, and a super specialization can be started in this area. Similarly, in other areas also, you can do this. Say, for example, in the other disciplines, say, for developing the nanoparticles and the herbal medicine for the wound healing. Similarly, for the cancer treatment. So, Dravya Gun and the Passage, there can also get involved. So, it is the teamwork, and with this team, you can come out with something and to convey the government to permit you for the practice.
Yes, sir. Thank you, sir. Any other question from the participant? I think, sir, there is no any other questions. Um,
Okay, Smita, thank you so much.
Thank you, sir. Thank you so much, sir, for this wonderful and informative session. So now I request respected Dr. Raman Singh, sir, President, NIMA Surgical Society, for the vote of thanks. Dr. Raman, sir. Sir, your voice is not audible. Sir, please unmute Karnaji.
I'm audible now.
Yes, sir, you are now audible.
We are very much thankful and obliged to Professor V.K. Shukla sir, because this is our first webinar of UP Surgical Society. Sir, it's so nice that in my whole life I have seen when I was also attached with the institute. Sir, never this deny for teaching and learning to any students, and he always provide opportunity to learn from various this learned peoples from India and abroad. I remember one Dr. Sen Pathak from Azamgarh. He was in USA and working in malignancy, and he told about the efficacy of haldi. Then we were very much surprised, and even in his tenure during the headship, there were a maximum these opportunities of lectureship which we have gone through, and I am very much obliged again that for the first webinar he accepted my request to talk on this webinar. So we are very much this obliged and lucky to have sir over here, and also I thank to all the organizers, Dr. Vidyarthi ji, Dr. A.K. Singh, Dr. Tripathi ji, Dr. Serkhani ji. He is the main person who is organizing this webinar, and thank you to all the participants who are participating and giving their important time to participate in this webinar. Thank you very much.
Thank you so much, sir. Thank you, sir, and all the participants for joining us and giving your precious time and knowledge. I hope you all find this webinar both informative and inspiring. Now, let's embark on this journey together towards understanding the making of a surgeon. Thank you so much. Thank you so much, sir. Now,